treating and not treating, you can say, teaching the yoga to the patient. So I found that one of the yoga teacher was teaching yoga to a diabetic patient. So he has shown all his reports, and teacher said, don't worry, I will make you all right. So what is there in your purse? He said that diabetic goli, the tablet is there. Throw it in the dustbin. Throw it in front of me. Now you don't need to take the treatment, your medicine, because I'm there. I'm going to treat you. This cannot happen. It takes time till the different practices which you are going to do, they have the effect on your body and make necessary changes in the body organs so that they will function properly. And then you can get, I don't say you can get rid of it, you can get the arrest, control or arrest of progress of disease, or sometimes the reversal of the disease. But you have to wait for that. So you cannot jump that, don't worry, from tomorrow you don't take the medicine at all. So that is a dangerous thing. So for that, I have taken this first hour, I will be giving in again talking about the principles of yoga as therapy for yoga professionals. Now, what are the principles? What you should remember when you are going to treat patients with yogic practices? Now, first, again, I am going to repeat the precautions while practicing yoga for healthy person and then for the diseased person or patient. The best time to practice yoga is early in the morning around 4:30 a.m. It is called Brahma Muhurta. From yogic point of view, it is said that that time both the nostrils are functioning properly. They are working equally. So that is the best time to practice yoga. Now the person, healthy person also can practice, and a person who has got some problem, disease, or is a patient, he also can practice at 4:30. But if it is not possible, क्योंकि हमारे यहाँ पे आजकल ज्यादा मात्रा में लोग सूर्यवंशी है. What is the meaning of सूर्यवंशी? Yes, madam.
Waking after Suryodaya. Waking after
Yes,
Suryodaya.
correct. So they are called Suryavamshi. So they say they don't know when sun rises. So those people, they can practice in the morning whenever they will get up. What they have to do, they have to brush, then they have to go to the toilet, clear the bowel, and then they should practice yoga. And after practicing yoga for at least 40 minutes, you should not take any food. So that is important. Suppose it is a thing that person has to go on duty early in the morning, so morning is not possible. Then he can do any other time of the day, provided he is not tired, then his stomach is not full. So suppose he wants to practice yoga in the evening, 6 o'clock. So he comes from duty at around 4:30, 5 o'clock, because he goes in the morning at 8, 7 o'clock. So gets over by 3:34, reaches home by 5 o'clock. So he can practice yoga at 6, 6:30, because he might have taken his lunch around 1 o'clock. And then in the office, usually you don't take very heavy food. So it is a light lunch. So after light lunch, you can practice yoga after the 4 hours of light lunch. And if it is a little heavy, then after 6 hours. Or whenever you feel that, no, I'm still feeling heavy, my stomach is still heavy. It is usually the feeling when you have taken very rich diet in carbohydrate and fat. Suppose you have taken lot of sweets. Then after 3 hours, 4 hours also, you will feel that, oh, stomach is very full, not at all yet empty. So those people, they should practice when they will feel that their stomach is empty. So for light lunch, 4 hours, for heavy meal, 6 hours, and the criteria should be you should feel that your stomach has become empty. Now, another important thing I always keep on giving stress every now and then, that yoga is a sadhana and not an exercise, and should not be practiced with force, which may be harmful, and it should be done as per individual capacity. I give examples for that. Usually, we do see that parents, when they are telling their children to practice some exercise, like suppose dumbbells, ball worker, or weightlifting, or push-up. So they will say, okay, start doing it. You will start counting. And the son is doing 1, 2, 3. He observes that your attention is not there. So he'll say 7, 10, 11, like that. Because he is doing it against his wish, against his body capacity. But here what is happening? Parents, no, you have to do 25 times. You have to do 15 push-ups. So he does it against his wish, against his physical capacity, and sometimes even uses force. So this is not good. In yogic practices, it should be without force, without using any, with your individual capacity, whatever capacity is there. Suppose you practice Bhujangasana, and if you are feeling tired when you start going up, so start with Sulabha Bhujangasana. Then after some days you go to the full Bhujangasana. So that way you have to practice. Then one should not practice one single asana or kriya, but whatever yoga module which is advised. Now, last 20 years, I'm practicing as a yoga consultant, and so many patients, they come to me and they ask me, sir, I don't have much time. You tell me one single asana or one single kriya, and I will do it religiously without failure. But that is not the correct thing, because you must have seen when you're observing different effects of yogic kriyas on body. Each yogic kriya or asana has got a effect on different parts of the body. So this has got a holistic approach. So whatever package you have made, if you practice that, then it will help to improve all organs of the body. So you cannot practice only one single asana and you will get full benefit. So never encourage any patient, okay, you practice only one this asana and forget about others. So this is not true. Then one should not try to reach to the final stage or maximum number of strokes in any kriya on the very first day or first week. Suppose you have been told that Kapalbhati you can practice up to 100 or 120 strokes in one set, and such 3 sets you should practice. Or asanas, you start with, suppose you take Bhujangasana. So you do first Ardha Bhujangasana or Sulabh Bhujangasana. Then slowly you go on raising your head up, then you can see that feeling. So that is the final stage. So this final stage, you should not achieve on the very first day, or you should not ask the patient to do it on the first day. In Kapalbhati, suppose you are starting Kapalbhati, ask him to do 10, 20, 30 strokes on the very first day. Continue it for 4 or 5 days. See that he doesn't feel breathless. Then you can add 30 to 40, 40 to 50, like that you go on slowly and increasing it. So this should be given step by step as per the individual capacity. This you remember. Never, so many times it happens that patient thinks that I want to get rid of all these problems fast. So I will also do 100 times. So don't do, because on the very first day, if he does 100 times, it will be a problematic for him. So this you remember. One should not practice yoga if you are tired. If you are very much tired, you should not practice yoga. Then ladies should not practice yoga during menses. When there are menstrual cycle is going on, that time they should not practice yoga, because any exertion, because usually from our ancient version also, nowadays nobody follows that. But in the old time, the ladies during menses, they were not allowed to touch anywhere in the body. They were asked to sit at one corner and not to do any activity. It was, meaning was that they should get rest. Otherwise, if they do exercise or if they do normal routine work, there may be excess bleeding. So nowadays, we don't follow that. But at least when you are practicing yoga, you should not practice yoga during menses. In pregnancy, you should practice yoga under supervision of experts. Who expert? The person who is giving yoga practices to the pregnant woman for suppose last 5, 6 years. So you work with him for at least 1 year. See, because each and every patient is different. No 2 patients are same. So you have to prescribe the yoga module as per the individual patient. So if you just attend 1 day course, 1 day for with the yoga expert who is giving yoga practices to the pregnant woman, you will not be any wise, because in one day you have how many patients you might see, suppose 5, 6 something, but then that is not all. So at least 1 year you should practice under the guidance of senior yoga teacher. And once you get all the pros and cons of that, then only you may venture in giving yoga practices to the pregnant woman. Because pregnancy is very delicate thing and very emotional thing. And suppose you give some wrong practices, like when you are discussing about the scientific basis, you must be remembering that forceful traditional Kapalbhati, Agnisar, we are not supposed to do. Why? Because it causes pressure on pregnant uterus. And if it is pressed, it may cause abortion. So that is why it is necessary that you should not practice yoga during pregnancy. If you want to practice it, it should be under expert yoga teacher, because there are different sets of yogic practices, asanas, for first trimester, second trimester, and third trimester. And if one practices yoga perfectly, a pregnant woman, she can get a normal delivery and she may not have much problem during delivery. So this is very important issue, and it should be tackled with very cautious way. Then one should not practice yoga by just reading the book or watching the television or somebody practicing it. Because suppose you are reading the book. By reading the book, you cannot understand the real methodology of the yogic practices. I will give one simple example. For ladies, they might be knowing this example. क्या बनाते हो, थालपीठ या चपाती या रोटी बनाते हैं, तो वो सब जो थ्योरी पढ़ता है, तो थ्योरी पढ़ के क्या देखेगा, वो आटा बुनो, ये करो, ऐसा करो, और उसके बाद में तवा जो है उसके पीठ के ऊपर लगाओ, तो वो उल्टा तवा रखता है और उसके ऊपर वो रोटी बनाता है, because he doesn't know which side is the correct side. So by reading the book, you may not be able to practice the yoga perfectly. So just reading, you should not practice. It is okay after you have attended the class, then you read the book, so you will understand it better than just watching the TV. That's why whenever there is big workshops are done, and that too they are shown on the TV. So people see on TV and then they start practicing yoga. But that is not the correct way, because you may not practice it properly. Then second thing, the observer is not able to see whether you are practicing it properly or not. And you might think, yes, I am observing from TV and doing it perfectly. But who will decide or judge whether you are doing it perfectly or not? That will be only done by the yoga teacher. So it is necessary that you should practice in front of yoga teacher. Then third thing is practicing by seeing somebody practicing. Suppose you are practicing yoga and you are doing different asanas or kriyas. So your brother or some relative or your friend, he will watch you and then you start doing it. So that is also not correct, because whatever you have learned, you are practicing at home, you may not be doing it 100% correct first. Second thing, the person who is observing you, he may observe it and he may imbibe it 50%. And when he is practicing, he will forget again 50% of it, and he might do only 25% correct. So it is better to practice yoga under expert guidance, because let him see that whether you are performing it perfectly or not. Once he is sure that, yeah, you are now practicing properly, then you can do it at your home without any assistance or without any guidance. Now, these things you should always tell to the patient, always remember yourself, and don't encourage to practice it by just watching the TV or seeing somebody or reading the book. By just joining yoga classes, patient cannot get cured. Remember, so many times it happens
that patient thinks that I joined the class, I registered that I have got diabetes. And so am I audible to you?
Yes, sir. Yes, sir.
So he think that I joined the yoga class, so there is no need of taking medicine. And even sometimes I told just now initially that over enthusiastic teacher, they said, don't take any medicine, throw it in the dustbin. मेरे सामने dustbin में डाल दो. To impress impress the patient, yoga teacher will tell loudly like that. I have seen that. I'm not telling of my mind. This is I observed when the new yoga teacher was teaching yoga to the diabetic patient. So it takes some time to get your organs activated because of different yogic practices. They will start functioning properly. And if they start functioning properly, then only you can get some effect. So don't venture to ask the patient to stop the medicine. Always remember this. I'll be repeating in this today's lecture 2-3 times. Now, who will stop the medicine? Or who will guide about the medicine to the patient? Once patient starts joining practices, then slowly the different activities, yoga practices will take charge of your body organs. Then they will improve. Then suppose a case of diabetes. If he starts practicing the given prescribed yoga module, slowly his pancreas will start functioning. His glucose will be utilized, so glucose level will come down. Now, how it can be judged and who will do it? So this patient, once he starts, how patient is diagnosed diabetic, he had some giddiness, he falls down on the road, and then somebody takes him to the hospital, and when his blood sugar was done, it was found to be 300. So that is how he's diagnosed. Now, once he is diagnosed, then what the doctor advises, he gives some tablets. He tells you take this for 8 days and again do your blood sugar level and come back to me. Then when you do blood sugar, then if with the prescribed dose, if it has come to normal, then doctor will say, okay, you continue this. If it is still high, then what he will do? He will add one more tablet. And then after 8 days, again he will ask, okay, do your blood sugar. Now, if it is under control, then doctor will tell, now this is your dose. Now we have, with the help of trial and error, we have controlled your diabetes. Now you continue this medicine for 3 months and come and show me after 3 months. So, and then again he gives one instruction. When you will come after 3 months, you please do your sugar and then come to me. Why it is told? Because that time you will see whatever tablets he has taken for 3 months, whether it has controlled your blood sugar level properly or not. This is okay. Now, suppose you have added yogic practices. So what will happen after 2 months? The pancreas might start functioning properly. So insulin might be secreted and sugar level will come down. Now he is taking anti-diabetic tablets, metformin or teneligliptin. So what is happening? He is taking the tablet and again he is doing yoga practices. Now, if because of the joint effect of both the things, the blood sugar level will still come down. Now, if blood sugar level comes down, if it goes below the standard level, he will feel giddy. And then he will go to doctor, sir, yesterday I felt giddy. He said, okay, you do your sugar. When he does sugar, it is suppose 50. Then what he'll say, Arey, what you are doing? Your sugar level has gone down. Have you not taken your lunch or dinner properly? He said, yes, I have taken properly. Then what happened? What you are doing? Are you doing something else? Then you say, yes, I'm doing yoga. Okay, you are doing yoga. Okay, so now your sugar level has come down. So what he does, he will reduce your morning tablet or evening tablet. Suppose he is taking 2 tablets, he will say, okay, now you take only 1 tablet. And again, he will ask you to repeat the blood sugar level after 1 month. So let his treating doctor reduce the medicine, because by seeing the blood sugar level, he will advise to reduce or increase the tablet dose. So let the doctor, treating doctor, decide about the dosage. You will not take the decision. Now, healthy without any disease can practice all yogic practices in a progressive manner and as per individual capacity. Now, since all of you are healthy when you joined the yoga courses. So you must have been advised to do all yogic practices and try to reach to the final stage, step by step, isn't it? Now, this is okay for a healthy person. But if he is a patient having some disease, then he should do it with caution and with his individual capacity. Don't force him to do, because he is already weak. His suppose heart is weak, or respiratory system is weak, or digestive system is weak. And then in that condition, if you tell him to practice more, he may get tired or he may get bad effect. So healthy patient can practice all yogic practices to the final stage without any problem. But the patients, they should be given as per their individual capacity. Now this, up to this it is okay. Now suppose patient is there. Now which patient you will give yoga and which patient you will not give yoga. So that is the next point. Now patients with acute conditions should take allopathic treatment to tide over the crisis of acuteness. Now what are the acute and chronic diseases that we'll see after next slide. Any acute condition, it cannot be treated any other pathy except allopathy. This is very important statement you must remember. Whenever there is acute condition, no pathy works except allopathy. No homeopathy, no Ayurveda, no Unani, no naturopathy, no pathy will work. So remember that acute condition, allopathy. Now what are the acute conditions? That we will see in the next. Patient should not practice whole of yoga module in a particular given disease within few days. That also I just explained to you. Patients should do it in a progressive manner, step by step, and without any force. Patients should never stop any medicine while practicing yoga unless advised by treating physician. So these are the very important things. Every now and then I will be hammering all these 3 points on you, because you should never forget this. Never be over-enthusiastic yoga teacher. Be a good yoga teacher, so you will get good results. If you want to try to say, I want to prove myself a very good yoga teacher, so I will give very fast all these things and he will get cured. No, it will not happen like that. You may get adverse effect. So don't be in a hurry. Do it systematically, methodically, and you will get good results. Now, you have been told about the basic principles. Then what is the responsibility of yoga professional? What you should know? You should know, suppose a patient comes to you, you should know which part of the body is affected any given disease. Suppose he comes and tells you that I have got regional ileitis or ulcerative colitis. So you should know which part of the body is affected. Suppose you don't know that which is the part affected by ulcerative colitis. And then nowadays, all the patients, they are made wise by the WhatsApp University and Google. So they have already gone through all the Google and WhatsApp and got the details about any particular disease which they are suffering. So they are knowing everything. And suppose you don't know, then what will happen when you tell, I got ulcerative colitis, then I am taking this treatment. What you will say if you don't know? Yes, okay, yes. By your nodding or by your doing this, patient will understand he doesn't know what is ulcerative colitis. And if he says, if he feels that you don't know ulcerative colitis, then how you will be able to treat me? So patient will not develop faith in you. See, the faith is the first 50% result. If patient develops faith in you, your 50% work is done. Remaining 50% will be done by giving different yogic practices. Now, what are the symptoms and signs of the disease? Now, when patient will come and he say that I have got ulcerative colitis, then you should know. And then you have got ulcerative colitis. So you get pain, cramps in the abdomen, Then you get alternative loose motions and constipation. You are feeling weak. So he'll say, oh, he knows what are the symptoms, which part of the body is affected. So he will develop faith in you. Then next question is, first you should know sign symptoms. Then next is what is the, whether the disease is acute or chronic. If your patient has come to you, whether he is suffering from acute disease or is suffering from chronic disease. Because this is very important to classify the disease of that given patient. Because once you classify it, then your line of action becomes clear. Because at the first sight, if it is diagnosed that it is acute condition, you finish, then you can say, no, this patient has to go to hospital for taking allopathic treatment, because it is acute condition. To tide over the crisis, he has to take allopathic treatment. Then fourth thing, what are the general investigations in a given disease? Any given disease, what investigations are done? Broadly, you should know, because patient will always come with all the reports and with the X-ray plates and everything. So you should know that what are the common investigations done in any given particular disease. If it is not there, you should ask him. So then, he knows it very well. Suppose a case of cancer. Then if you ask him, show me your biopsy report, then he will understand, he knows the subject. Then can we treat it, this particular disease, with yoga? Once you have classified whether it is acute or chronic, then you have got a general idea of that given disease of the patient. Then you should think in your mind whether you will be able to treat this patient with the help of yoga. If yes, then the next question comes, can yoga cure this disease completely? Whatever the problem patient has got, are you able to treat him completely with the help of yoga? So that you should be able to tell him, yes, I can cure him completely. Or, yes, I can cure you, but you have to continue your medicine. Or, yes, I will give you treatment, your tablets might be reduced. Your complications might not be there. So these three categories you should be able to tell the patient. What is the first? Yes, you will be cured completely. Second, that this will be as an adjuvant therapy and your doses of medical tablets may be reduced. And third, you will not face the complications of that given particular disease. This is very important in cases of diabetes and blood pressure. What are those different complications that we'll see when we are learning diabetes? Then we must know the indications, contraindications, and limitations of yoga practices in each disease. This is very, 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 very important. Once you know your limitations, you will not venture in an area where you should not go. So you must know what are the indications of yoga practices in any given disease, what are the contraindications and limitations, up to what level, up to what limit you can give yoga practices. So all these future lectures will be telling you what are the indications, contraindications and limitations of yoga practices in each disease. We will be covering all the disease system-wise, like respiratory system, all the diseases in the respiratory system, digestive system, central nervous system, like that. Now, whether yoga to be given as preventive, curative, adjuvant, or palliative. So this also you can explain to the patient. So all these ideas, if they are clear, then you can proceed further. Because Swamiji has said, as yoga can keep you healthy, or sometimes it can cure you also, but there are some limitations. Not all patients can be treated by yoga, because Swamiji has said, Swami Kolananji has said, every pathy, every therapy has its own limitations. So too is the case of applied yoga as therapy. So yoga as therapy also it has got a limitation. So that you should always remember, and it should be at your back of the mind. Now, human body, when it is functioning properly, normally, that is a physiological condition is normal. But when any of the organ is not functioning properly, it leads to pathology, means the disease is there. So when physiology changes to pathology, the disease comes in. What is disease? When you are not at ease, is disease. Now, disease may be congenital, that means inborn defects. Sometimes you might have seen that patient, boy, the birth of the boy, fetus, they say that from birth he has got a hole into the heart, or from birth only his fingers are something like that, or there may be extra finger, or that might be some deformity in the nose or in the ear, or something like that. So that is a congenital deformity. Inborn deformity means by birth he is having that problem. Now, second is a acquired, means it is because of the some external thing like organism or stress. So congenital, these are inborn defects, and acquired is an organism because of organism. Now, in organisms, it may be bacteria, virus, and second most important is the stress, which is very important because 21st century is called century of tension. Now, the types of disease, as I told you initially, it may be acute, it may be chronic, or it may be acute and chronic. Now, what are the acute conditions? Because I told acute conditions, they are not our baby. Any acute condition, yoga will not help. So he has to go to allopathic medicine because he has to tie over the crisis, then only he will be surviving. So what are the acute conditions? So we'll see one by one the acute conditions.